three, two, one, one.
Hello, everybody. Thanks for joining us. Dr. Weegriff here at Pure Plastic Surgery. It's our Thursday Thoughts. We're going to be talking about a very common question we get during consultations for people that are getting a breast aug for the first time or people that have had a breast augmentation in the past, and that is, when do I need to change out my implants? When do I need to get an implant exchanged? And there's really no hard and fast rules about this. There's some guidelines that we use, but I'm going to be going over a few of the reasons why you may want to do that or consider doing that. So to start with, we kind of need to differentiate between the two types of implants that we use, and those are silicone and saline implants. So with saline implants, you know if you're going to have a rupture because you get a flat tire. If you rupture a saline implant, your body absorbs that saline and you're going to notice a change in the shape of your breast. With our silicone implants, you don't necessarily know if you've had a rupture, especially with the more newer generation of breast implants, the gummy bear implants, because they maintain their shape and you may not know. So you need to get imaging starting at 5 years after replacement, and then every 2 to 3 years after that. And that can be either an MRI or an ultrasound. And we're able to visualize the implant, make sure the capsule is intact. So manufacturers most manufacturers guarantee the implants for a minimum of 10 years, and that's how long they assume they should last. So people get the idea like, oh, I need to just exchange my implants every 10 years. That's not necessarily the case, especially with the most current generation of breast implants. These probably actually last quite a bit longer than 10 years, and as long as you're not having any issues and you don't have any evidence of a rupture on those imaging tests that I just talked about, you probably don't need to replace them at 10 years. You can wait 15 or maybe even 20 years. Sometimes when you would want to consider doing this earlier is if you develop something that we call a capsular contracture, where one side is getting harder than the other side, or the shape of the breast is changing a little bit because of that capsular contracture. That's a good indication to get a breast implant exchange and possibly have some capsule work done at the same time. Another thing you may want to consider is there was a period of time that a lot of surgeons were using textured implants. Now there's been a very rare link with this very rare form of lymphoma that is linked to textured implants. And again, it is exceedingly rare. And the only time you really have to be concerned about that is if you were to develop a fluid collection around your breast implant. So if you were to notice that one breast was getting larger than the other all of a sudden, you need to get that looked at, you need to get an ultrasound, and we need to take a sample of that fluid to investigate this. But some people just want to have the peace of mind of having those textured implants out. So that would be another indication to remove textured implants, which just means that outside coating of the implant has a rough surface, kind of like sandpaper. Whereas nowadays, all we're using, or especially myself, is using smooth, round implants, meaning the texture on the outside is very smooth, and that has not really been associated with this very rare form of lymphoma that some of those textured implants have been associated with. So if that's something that you have and you're just wanting to get it out for peace of mind, that's another reason to get a breast implant exchange. Does anybody have any questions about this?
This one, is breast implant illness triggered due to an autoimmune disease? Is there a way to test for autoimmune diseases prior to deciding if you want an implant?
So no, this is a very nuanced subject that's hard to cover in a short period of time, but breast implant illness is a constellation of symptoms that some people have associated with their breast implants. Even though in very large studies, we've never been able to see a causal relationship between the two. But if you are predisposed to autoimmune type disorders, you may want to talk to your rheumatologist, and you may decide that breast implants just isn't something that you're willing to take the risk of getting for the possibility of having issues with it. Again, there's been no actual causal link between the breast implants and any one type of autoimmune disease or constellation of symptoms, but there are anecdotal, personal experiences of people who said they had their implants removed and they felt much better afterwards. So that's something we can definitely do another Thursday Thoughts on to cover in a little more nuance, because it's an important subject that's getting a lot of attention right now. But I think there's also some false information floating around about that. But in terms of a specific test to get before you get breast implants to see if you're prone to it, no, we don't have anything for that.
I like this one. Is there any way I could shadow you? I'm currently an undergrad student aspiring for cosmetic surgery.
That's a good question. I'll have to check with our insurance and see if we're able to accommodate a medical student, but if we are, I'd be happy to host you.
Okay. I'm thinking in an implanted change to go smaller. I'll need a lift.
Yeah, so most of the time, if you're wanting to go smaller, that implant has already created space. So it's actually created more space than what the implant is already in there. So it's typically a good indication to go up in size a little bit, unless you're willing to get a lift. Then we can definitely downsize the implant and do a lift at the same time.
How long have you been a surgeon?
Well, I graduated medical school in 2013. I did 9 years of training, and then I've been in practice for 2 years now.
If a different image appears between two breasts, one breast from the other, if it's much larger, will this be due to a change in the silicone? If you want to read the question, just right here, doctor, because my accent.
Yeah, if a different image appears between two different breasts and one breast from the other. It could be, and that's one of the signs of capsular contracture. If you got two equal sized implants and they look the same right after your surgery in the first few months after your surgery, but then the shape of your breast started to change, it's sometimes due to that capsular contracture because that constricts the tissue, sometimes gives you more upper pole fullness on the side of the capsular contracture with kind of a waterfall deformity with your breast tissue falling off of it. So that's a sign possibly of a capsular contracture.
Okay, this is on TikTok, and she said, I'm thinking in an explantation. Do I need a lift? Some silly question.
So, most of the time, if you're getting an explantation, you will need a lift. If you're young and you didn't have very large implants, I've done several patients that haven't needed a lift, but you need to be able to accept, obviously, change in the symmetry of your breast. One of the unique things we can do is if you had saline implants and you're considering an explant and really don't want to replace them, I can pop the saline implants in the office, we can let them deflate, and you can get to test drive what it would be like to have them without a lift for a few months, and also it allows your tissues to shrink up a little bit during that time. If you're happy with it, I'll just remove the implants with a very simple procedure. If you're not thrilled with it, we can then proceed with the lift.
Okay, just 1 second. Old messages. Do breast augmentation and lifts have a low mortality rate?
Yes, extremely low mortality rate. Exceedingly low.
Okay, Doug, I'm reading here at Pure, just 1 more second. Okay, and we have the last question. You have an age limit for breast procedures?
The age limit is you need to be at least 18 years old. And you also need to understand if you're going to get silicone implants, all studies done on silicone implants were patients that were 22 years and older. So sometimes the manufacturers of the silicone implants won't warranty them for patients that are younger than 22. I don't think there's any difference in an 18-year-old and a 22-year-old in terms of using silicone versus saline, but that's how the studies were done. In terms of an upper age limit, as long as you're healthy, up to 60 years old, I'm happy to do it.
58?
Sure, absolutely.
Can surgery be performed from the nipple? There are previous nipple correction and stitch marks.
It can be done through the nipple. You can do a breast or a periareolar incision, meaning around the border of the areola. One of the downsides to that, though, is an increased risk of that capsular contracture that I talked about, because then we're cutting through some of the milk ducts that can harbor bacteria and lead to contamination. So I tend to always do my incisions through the fold of the breast. All right, everybody, thank you so much for your questions. That was a great topic. Let me know if you have any further questions, and feel free to reach out.
Thank